What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. And if you had to take a test for any of those other viruses that are running around, I hope you tested negative. And if you did test positive for them, I hope you have no long-term issues. It is time now for the Friday Virus Update for Friday, November 15th, 2024. If you're new to my channel, welcome to my channel. You've clicked onto the channel that does updates on all the viruses that, well, can make us sick. There's a lot of viruses out there. H5N1. It's becoming an increasingly big deal, really. It's starting to. We're going to talk about that today. COVID, it's still out there. COVID did not go away. It's not going away anytime soon. Yes, levels may be really low now. In fact, lower than we thought they would get to at this point. A lot of people are surprised that, hey, COVID levels are still dropping, but at some point that will change. Thanksgiving in the United States is just about a couple weeks away, and when that comes, a lot of people are going to gather together, mixing and mingle, and regardless of what's going on with the variant picture, that is going to cause some more cases, not just of COVID, but of other viruses as well. Want to stay informed with what's going on with all these viruses in the United States? Just subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And of course, leave your comments down below. I'm sure there'll be a lot of comments today because we do have a few hot topics to talk about, with one of them being H5N1. I mean, we have to discuss that. 11% of residents test positive for COVID at McKeesport Community Living Center. This is in the Pittsburgh area of Pennsylvania, out in western Pennsylvania, and it says here, officials at the Allegheny County Health Department have confirmed an outbreak of COVID-19 at the Kane Regional Center in McKeesport on Tuesday, which began on November 4th, and now represents 11% of its population. So that means 23 residents living in the community, home to elderly residents and adults in need of assisted care, have tested positive, an increase of 35% since the Sunday report. Don't see anything since then, but yeah, that's not good. Even when COVID levels can be really low, if the conditions are favorable, if someone, for whatever reason, showed up at that assistant facility, positive for COVID, had contact with someone else, was not wearing a mask, was not taking any precautions, someone else catches it, and you know how it goes, the domino effect. It keeps on rolling. More and more people test positive. So this is not a good thing. It doesn't matter what the national level of COVID is. Outbreaks can still happen. All right, taking a look at this. Now some good news. Paxlovid cuts COVID hospitalization death risk and speed symptom relief study finds. Well, that's some good news. Just reading the headline here, because we do have a lot of things to get over today. Remember, we're not doing these every day anymore, just 2 to 3 times a week now. Hawaii, health officials detect bird flu in wastewater for the first time. Yes, this is relatively concerning. It's showing up in more and more places, and in fact, I do have a graphic that I wanted to show you today. This has been making its rounds on Twitter. Are you still on Twitter? Let me know down below. Did you move over to Blue Sky? Yes, that is a real thing right now, and you can't see it here, but there's some numbers on the bottom right. H5N1 infected dairy herds as confirmed by USDA. California, 291. I think that's a big problem. Don't you? That's a large number. And it says the cumulative total national tally is 505. Colorado, 64. Idaho, 35. Michigan, 29. Texas, 26. Iowa, 13. Utah, 13. Minnesota and New Mexico both have 9. South Dakota, 7. Kansas, 4. Oklahoma, 2. Ohio, 1. North Carolina, 1. And Wyoming, 1. Okay. This is really spreading out of control in dairy herds, but we know that there's been human cases this year, not just in the United States. There recently was a teen that was infected up in Canada. He's still in the hospital, last I heard, and he was not doing well. He was previously a young and healthy person. So yeah, that's concerning, and what else is concerning with that is the fact that we don't know how the heck he got it. And it's also sounding like there could be different mutations of H5N1. You know, the regular common flu can do this as well. COVID, as we all know, there's been various different variants. We had Wuhan 1.0. Was that actually officially a name of a COVID variant? I don't know. The original strain. Then there was Alpha. Then there was Delta, Beta, Omicron, BA.1, which was Omicron. Now we're on XEC coming up pretty soon. That's still rising, although it's not rising all that fast. But you get the point. Viruses can mutate. H5N1's getting smarter and trying to do that as well. And I don't know. Are we on the heels of another pandemic? If we are, will the next administration take it serious? I don't think so. I don't think they will at all, based on what I'm seeing. And based on what you're seeing if you're watching the news lately. Yeah, you get the idea. Anywho, respiratory illness is on the rise in Metro Phoenix. Doctor says so. Respiratory illnesses, coughing, sneezing, sniffling, and general health-related suffering are plaguing people across the valley. Ooh, yikes, that doesn't sound good. It is, after all, getting to be that time of year. In San Diego, it's whooping cough that's the problem. The cases are on the rise across San Diego County. The number of pertussis cases, also known as whooping cough, are on the rise in San Diego. County public health officials reported a notable increase in cases this year over recent years. Since the beginning of 2024, there have been 547 cases reported in the county, to compared to 332 cases in 2023. That's a pretty big increase. It says the ages of those who have been sick range from newborns to 85 years old, while the majority have been between 11 to 17 years old. So that's not a good thing. And of course, as you know, if you've been following to my channel, if not, I'll fill you in. There has been a large national increase all across the United States. I don't know what the latest national numbers. We got to be close to 20,000 cases nationally at this point. I think the last one I saw a few weeks ago was 18,000. And that number's been continuing to go up. If it hasn't hit 20,000 yet, it probably will by the end of the year, which is, again, that is not a good thing. A reminder, my website is datareport.info. If you want to join in there, I know a lot of people are leaving Twitter. If you want to join in there and talk about any of these viruses, we talk about long COVID, COVID itself, COVID studies. I add and archive studies. I'll probably be working on the site some this evening, maybe. And, of course, you can see your influenza, H5N1 in humans. That could use an update. I got to admit, there's been nothing in there since August. Yeah, I got to update that. I got to put something in there, especially with the Canadian case, Mpox, measles. No measles story today, but I did tweet something earlier about measles, that there is a global, or at least I think I tweeted it, there is a global rise in the number of measles cases, so that's not good to report. All right, moving on. The UK. Generally from the UK this week, and let's refresh this just to be sure it's up to date. Yeah, good news. UK cases continue to drop. 1,517. That is down by 649. Deaths this week. 248 deaths were added. That's down by 18. Patients admitted to the hospital. That is coming up as of October 31st, 1,960. So overall, good news from the UK, and a brief reminder. Last year at this time, I think it's on one of these charts. We could try and find it. I doubt I would be able to. But last year at this time, the UK was still dropping as well. Then in December, they started rising again. This may be the chart I was thinking of. This is, I believe, the positivity rate. Yes, you can see here, dropping right now. Last year at this time, they continued to drop. Then in December, they did start to go up. All right, moving on now. Let's take a look at what's going on with the air qualities in the United States. And wildfires are still a thing in some areas. New York City. Yes, there was actually a wildfire near, I believe it was Central Park. And then, of course, North Jersey as well. We can see there are still a few bad air quality areas there, and in the Great Lakes, and, of course, the West Coast as well still has some air quality issues. Philadelphia over the last several days, and I do need to actually pull this up. Looks like yesterday. Wow. 690. I'm just now seeing this. This needs to be reshared. 690 EMS incidents reported yesterday. That is the lowest number I have seen out of Philadelphia in a very long time. And then the day before, for Wednesday, 725 EMS incidents. And on Tuesday, it was 755. And the total for Monday was 882. But overall, EMS calls in my city of Philadelphia have been down this week. All right, talking about climate, we talked about air qualities in a moment. ago. Want to learn more about climate and weather? You can do so over on my X page and over on Blue Sky, and of course on my other channel, which is Climate Data Report. Not certain I'm going to be posting a video there today. Probably be posting the next video there tomorrow, since we're doing this video here today. Let's do a live look in right now at southeast Pennsylvania and see what's going on with the EMS call activity. Not terribly busy at all right now in Montgomery County, just 10 EMS calls. And over in Chester County, Pennsylvania, we do see respiratory difficulty showing up a couple times, sick person, heart problems a couple times. A few calls to be had, but not a lot of calls at this time. Let's see what's going on with hospitals in Pennsylvania, and we do see majority of the central PA hospitals are not reporting, but we do see a lot of green across the lower Susquehanna Valley, Harrisburg being the capital, and we see green at the sites that are, or the hospitals that are reporting in western Pennsylvania, and we do see some yellow showing up in the Lehigh Valley. Let's click on a couple of them. And St. Luke's, Bethlehem, that's a behavior health diversion. St. Luke's Easton campus, it says the emergency department is overcrowding. That's not a good thing. And we also see that St. Luke's, we clicked on that already. And let's come over here, St. Luke's Anderson, emergency department overcrowding. Monroe County, it's the Pocono Mountains, that also says emergency department overcrowding. And I've noticed it constantly says that almost daily. And yet again, we do have a problem at Penn Medicine, Chester County Hospital, near Westchester, Pennsylvania. That's on East Marshall Street, and that is Westchester, and that's overcrowding as well. So not a good thing. Pennsylvania wastewater. Overall, not terrible. The majority of the sites are either no change. A lot of them did not report, but we are seeing an increase. I believe this is Franklin County, yes, in the area of Chambersburg. There is an increase there. And on the northern side of Allegheny County, there is a decrease at this time, which decrease is a good thing. All right, moving on now to Canada. The COVID-19 viral activity level is listed as moderate at this time. The viral activity level for flu A is low, flu B not detected, and the viral activity level for RSV is in the moderate category at this time. All right, Walgreens for this week. No, I don't want to go shopping at Walgreens. I literally just said that on screen. National positivity trend for COVID this week is 13.2%. The prior week was 14.1%. That's a difference of down 0.9%. Total test was down slightly, 4,009 versus 4,190. Let's look at a few states. Taking a look at what is going on in Kansas, 10.7% positivity rate. The prior week was 12.9%. Total test, 28 versus 31. The positivity rate did drop by 2.2%. In Arkansas, the positivity rate went up slightly, 16.2% versus 5.3%. And that was up by 11%. Total test, 37 versus 38. In New Mexico, the positivity rate is 32.1%. The prior week was 26.1%. That's a difference of up 6.1%. Total test, 28 versus 46. Testing did drop. California, 7.7% positivity rate. The prior week was 13.9%. Difference of down 6.2%, and testing was up slightly. Washington, the positivity rate is 20%. The prior week is 10.4%. That's up by 9.6%. Testing, 55 versus 67. North Carolina, will end on a good note here. The positivity rate is 8.4%. The prior week was 13.4%. That is down by 5.0%. And total tests, 215 versus 261. All right, the latest variant of COVID at this time is the KP 3.1.1 variant at 52%. XEC is still at 28% at this time, and I am hearing in the UK it is still the KP 3.1.1 variant that is dominating. If anyone knows otherwise, let me know down below, but I've seen a few ex-posters post that that was still the dominating variant there. All right, wastewater. We need to refresh this. Maybe we're not getting an update today. I've been checking all afternoon. Hopefully, it has finally come in. We're about 2:45 in the afternoon. Is it even going to load? There's a question. Well, the national wastewater viral activity level for COVID-19 is still currently low. And nope, these are the same numbers from last week, but generally, we're still seeing good things here, although it's saying here that there is 400% increase in 80 to 100%. I think that just went up by 1, but again, I believe these are the same numbers from last. And if you take a good look at the map, you can see there's not a lot of orange and red, which means things are not rapidly rising yet. And as of the last time this was updated, which again I believe was last week's update, well, it says here November 9th. You know what? No, this may be a new update. The point is, we are still dropping. That is some really fantastic news. Let's take a look at WastewaterSCAN real quickly, and we'll just do a couple things on here. First off, nationally, COVID. It is still listed low. RSV is still low, but it is rising at this time. Influenza A is low. Influenza B is low at this time. HMPV is low. Norovirus is still high, and it continues to rise at this time. Let's just click on a few WastewaterSCAN sites. Let's go up to Newark, New Jersey. I want to know what's going on there. COVID still listed low at this time. RSV, though not calculated, is starting to rise more. Influenza A not calculated. Influenza B not calculated. HMPV is still low. Norovirus, look at that. It's still, yeah, there's still some issues with norovirus. It may be trying to drop, but overall it's been going up. And there was a detection of Mpox clade 2 back on October 9th. And we can see here hepatitis A, yes, some detections of that as well. And let's go out to the West Coast just to be fair. And we'll take a look at San Francisco. I want to know what's going on in the Bay Area. And we'll take a look at the eastern site in San Francisco. COVID is low at this time. RSV is still low. Influenza A is medium. It's still rising a bit. Influenza B is low. HMPV is low. Norovirus, wow, rapidly rising and already listed as high. That is not good. All right, taking a look here at some positivity levels for different viruses, and we can see here, as of the most recent update, some of the viruses are rising. The majority of them are not, though, at this point. RSV is starting to see somewhat of a rise for the positivity rate. COVID positivity rate overall, as of the last time this updated, is still dropping at this time. Taking a look now at emergency department visits for COVID, and we can see here, these are people diagnosed with COVID that show up. We can see on the chart, it is still dropping at this time. We're not seeing a rise just yet. That is some good news. On the next update that I do, maybe we'll go state by state. Epidemic status. It is growing now in Minnesota. It is likely growing in Arizona and California at this time. A lot of other states are still likely declining or are declining at this time, and it's not changing in several states as well. But then when we come down to influenza, it's a more bleak picture. It is growing in all the West at this time. The majority of the South is either growing or likely growing. Some states in between that are not changing. Then you do see some states in the Northeast likely growing. And then you do see some states such as Illinois and Minnesota. Hey, they're growing at this time. Iowa and Indiana are likely growing at this time. And here is the influenza-like illness map, and we can see here that the highest shade of low is now showing up in Louisiana, Georgia. D.C. was listed, I believe, as high last week. I think we can go back 1 week. D.C. was listed high last week. Yeah, you have now dropped back down to low, so that is some good news for you. Not seeing the big quick surge across the country like we saw last year when things started up earlier than normal. In New Jersey, let's take a look at what's going on here with some hospital data, and we can see here Capital Health McHopewell. This is in Mercer County, New Jersey. It says adult ED status, patient volume for 4 hours. It looks to me as if they are diverting due to high patient volume, and let's see, not seeing anything else when it comes to full divergence here. Taking a look at what's going on in New York State, 464 cases on the most recent update. So, hey, New York State continues to drop at this time. That's some good news. New York State hospitalizations, take a look at this. They continue to drop as well. 389 reported, 43 people in the ICU. Let's take a look at what's going on with Los Angeles. Let's see if their positivity rate is starting to rise. Hospitalizations did go up ever so slightly, and the positivity rate for COVID, it's still dropping at this time, which is a good thing. And it does look like wastewater did go up ever so slightly, but really we're just probably at the bottoming right now is what's going on there. And let's take a look at California in general, if it did update. If it ever comes up. Here we go. COVID positivity rate is 3.5%. Flu is 2.1%. And RSV at this time is 2%. So all of them went up just ever so slightly at this time. Ohio, kind of a mixed picture. The cases continue to drop. they've been dropping. It's 2,239 cases reported. However, you saw a good size, a decent sized hospital increase. There were 83 added the previous week, and then in this week's report, it's 145. So that's telling me not enough people are getting tested. If you're seeing cases drop, but yet hospitalization number is coming in higher, yeah, there must be a lot of people not getting tested, and I can't see. Did the positivity rate go up? And I wanted to show you this, but you see, their dashboard just froze up. Finally, we got the rest of the data back from Ohio, and we can see here their dashboard is no longer frozen. The ICU number dropped down to 3, and deaths, there were just 15 reported in the last week. Let's take a look at Colorado, and I need to make sure this is up to date. Okay, it is. COVID hospital admission count, 55. That's down by 42. Influenza is down by 6, just 9 reported there. And RSV is up by 2, with 8 being reported. And we can see the positivity rates. They did all go up slightly, COVID, influenza, and RSV. COVID is 6.53%. Influenza is 3.21%. And RSV is now over 1%. Taking a look at Washington, and I do need to refresh this again, make sure it's up to date. It looks like it was already refreshing itself, but overall, we're not seeing bad things here either, at least not for COVID. It looks like the emergency department visits percentage for influenza has gone up some 50% more than the previous week, but everything for COVID is dropping. A COVID-19 number of ICU beds occupied is 13, that's down by 4. So overall, in the hospital in Washington State, you're doing pretty well at this time when it comes to COVID. Alrighty, folks, that does it for the Friday virus update. I think our next update is going to be on Monday. Monday and Friday seem to be working. If anything else needs to be added in between, of course, if anything big pops up, I'll do one of those YouTube shorts, or if need be, I will come back onto you with a full video. And I think this schedule is working much better for the time being. Will we ever go back to daily reports? I'm not going to say no to that, but it's possible in the future. But the way my schedule is, everything I do, this is just working out right now. So I will see you all again on Monday. Until I see you again on Monday, you have to do me a few things. Number 1, if you like this video, give it a thumbs up. Number 2, subscribe if you're new down below. And of course, share this video with anyone you know. Hit that notification bell. And leave your comments down below. And of course, most importantly, please have a safe weekend. I will see you all again next week. Take care. Enjoy your weekend. Thanks for watching, everybody.